Yeah, we will.
Yes, ma'am. So now we are live.
Yes, sister, with your kind permission, can we start the program?
Yeah, start.
Yes. Bhavna ma'am, please.
Okay, William. So, Honorable Director, Reverend Father Simon Raj, respected Principal, Dr. Sister Alice Thomas, distinguished guest speaker of today's guest talk, Dr. Aliza Anthony, the IQAC coordinator, Dr. Goldie Zaki, and my dear friends. So, today we are gathered here for the session where we will know about the corona wave, third wave. So without further ado, whenever we will start any event, we will start with the blessings of God Almighty. So I request our Professor Stafford Anthony to seeking the God's blessing.
Bhavna ma'am, am I audible?
Yes, you are.
Yes.
Thank you, ma'am. Let's place ourselves in the presence of the Lord. I request everybody to close your eyes and join your hands and be ready for the prayer. Dear God, we offer everything to you during this session. May we ask for your blessings and divine providence that the activities set for this session and undertaking be successful and effective for all of us. May we also retain the invaluable knowledge and learning experiences that we derive from this session for actual application when we leave this gathering. We pray that you bless all the committees, all the members of the faculties, the speaker in charge, that they fulfill their task responsibly and the objectives of this session get achieved. Your generous blessings would mean the success of this session. We know that without it, we cannot do nothing. May we will be living witnesses of your genuine love to the implementation of the knowledge acquired through this session. Grant us your divine wisdom as we go about our task after this session. This we ask in the name of Jesus Christ. Amen.
Thank you, sir, for your divine prayer. Now I request our IQAC coordinator and head of the Commerce Department, Dr. Goldie Zaki, to introduce our esteemed guest and welcome everyone participating in this virtual guest talk.
Thank you, Bhavna ma'am. Am I audible?
Yes, ma'am.
Yes. So a heartfelt and pleasant evening to one and all present in the IQAC session initiative for the protection against third wave of corona. On behalf of St. Paul Institute of Professional Studies and Internal Quality Assurance Cell, I extend a heartfelt welcome to all present here. First of all, in the absentia, I would like to welcome our Director, Reverend Father Simon Raj, who has always been granting us all the support that we need for organizing these events. Very cheerfully, I would like to welcome our dear Principal, Dr. Sister Alice Thomas. She is a real source of motivation for all of us, and I would like to express and acknowledge that sister is the one behind this session, and she is the one who has coordinated Dr. Eliza and has encouraged us for organizing this session. So thank you so much, sister. A cordial welcome to Bhavna ma'am and Stafford sir, who are strong members of the IQAC team, to all the esteemed faculty members, and also to the staff members present in the meeting. A cordial welcome to all the students and participating watching this program on YouTube Live. We are indeed very fortunate to have in our midst Dr. Eliza Anthony. And really, it is a proud privilege to introduce her. Before her introduction, I would very cordially like to welcome Dr. Eliza, who is the resource person, the guest speaker of today's event. And at the outset, I wish to thank her because she readily accepted our invitation and she is here to present her views to guide us more on this topic. So, as an introduction, I would like all of you to know that Dr. Eliza Anthony is an ophthalmologist working as medical consultant at Arvind Eye Hospital, Chennai, since the year 2018. She completed her medical degree in St. John's Medical College, Bengaluru, and her post-graduation in ophthalmology at Girdhar Eye Institute. The history of her schooling goes back to St. Raphael Schools, that is from Indore. She has 6 years of experience in ophthalmic surgery and completed her fellowship in medical retina and uveitis from Sankara Netralaya, Chennai. She has worked as in charge and head of Semiranian Hospital, Khategaon for 2 years. She has special interest in research in retina and ocular inflammation and multiple publication in international journals to her credit. So really today we are fortunate to have Dr. Eliza in our midst. So welcoming all of you once again to this program, I conclude. Thank you. On to you, Bhavna ma'am.
Thank you, madam, for your warm welcome and introduction of Dr. Eliza. So, dear audience, our country is putting its all strength in fighting with the corona. But now we should prepare ourselves to fight the coming corona third wave. Researchers have already issued warning about the third wave of corona. In this situation, what is the problem you may face and how to protect yourself when you come in contact with it will be told by our eminent speaker, Dr. Eliza. So without further ado, I would like to invite our esteemed guest speaker, Dr. Eliza Anthony, and along with this, I request our viewers and audience that they can put forward their questions through the WhatsApp group or chat box on the board. Dr. Eliza, over to you.
Thank you so much. At the outside, before I start, I would like to thank the director of St. Paul Institute, Reverend Father Simon Raj, and especially the principal, Dr. Sister Alice Thomas, for giving me this opportunity and being a part of this webinar. And thank you, all of you, to come and join me here, because this shows that how responsible we all feel to break the chain of spread of COVID-19, especially at this time, okay, when we are on verge of facing third wave. So all the youngsters who are also watching and being a part, welcome all of you. So let's get started. Okay, so how to protect against the third wave of COVID-19? So what is this coronavirus? It is a RNA virus, which is which has crown shape appearance, and hence it is called coronavirus. Coming to the incubation period of this virus is very small. It's just 2 to 3 days. And what's important is the patient is infective even 1 or 2 days prior to the onset of symptoms. So this is very important, that even if the patient is asymptomatic, he has no symptoms, he can still transmit the disease. So coming to what is this third wave and why it is so important? It is important because it involves the most vulnerable of the population, that is children, and they are precious and they are future. So most of the children can have simple or moderate symptoms, but some of them can have very severe symptoms and can involve multiple organs. So they call it as multi-system inflammatory syndrome, where multiple organs like heart, lung, blood vessels, kidney, everything can get involved, and they can get swollen, what we call it severely inflamed. So this is a serious condition. So in order to prevent that, we cannot expect the children to be more cautious and be responsible. So it is very important for us that people around the kids, that is we need to be more responsible and to break the chain of the spread so that they are protected. And second thing is, in case if a child is sick, the most important thing is you need to consult a physician first, because the management of the child is totally different. Second thing is you can't isolate a child. An adult will be always there with the child, a caregiver to take care of the child. So it's very important that the person also is well masked and knows how to protect himself or herself while taking care of the child. And the third thing that I want to highlight is when the children are infected, try to keep them away from their grandparents, because they are also very vulnerable and can develop severe complications if they get or they contract COVID-19. So, how do you identify this COVID-19 in children? So, symptoms are quite similar as in adults. So, I want to first discuss the GI symptoms because they are very unusual. So, the patient can come with pain in abdomen, vomiting, diarrhea, fever, we are all aware of, breathing difficulty, fatigue, cough. So we know children are very active, but if they become suddenly very lazy, tired, it should alarm the parents. And lack of appetite, they won't feel hungry, they don't want to play, there will be loss of taste and smell. So these symptoms, these are same symptoms which can happen even in the adults. So if any of these symptoms come, please get alarmed and take care. So how do we do that? So this is a small video. It's a fun video. Most important thing is I want to highlight is none of them here is wearing mask in the video. So most important thing to prevent the spread is to wear a mask. And let's see how this COVID is spreading if you don't wear the mask. So it's a small video. Let's go through it.
Justin had an awesome weekend. Now that it's Monday morning, he's taken the good vibes into the office and surprising his work pals with donuts. Problem is, tasty treats aren't the only thing he's about to share. Justin doesn't know it, but he picked up a germ at a concert last week. Now he's sprinkled his donut box, his hands, and the office door with those germs. In real time, as Justin says good morning to John, and Ashley grabs her favorite Boston cream, those germs have hitched a ride onto two new hosts. With a rub of the eyes and a gulp, they're through the human front door and ready to get down to the business of making people sick. A little later, George comes with the mail. Justin offers him a donut, and with a tickle in his throat, turns his head to cough. Justin says bye to George and leaves more germs behind. George starts making his deliveries, and as you can see, there's no return to sender on Justin's leave behind. All it takes is a touch of the germy mail, and then a touch of the mouth, nose, or eyes for a person to become infected. When it's time to call it a day, Ashley brings the infection onto the train. She hasn't washed her hands in hours. The germs covering them make a pit stop on the grab bar before finding a home on some new hands. A few cars over, Justin is coughing again. In these tight quarters, that's bad news. He and his fellow passengers get off the train and head to their homes. The spread continues. What if Justin's morning had gone more like this? A sneeze into the elbow, and then some hand sanitizer to be safe. A cough into a tissue, and a good job throwing it away and washing hands. Coworkers don't touch their eyes, noses, or mouths, no matter what. By following those steps, Justin's germs could have stayed away and slowed the pace of the spread.
So these are the very important things that we all know. We all wear masks, but many times in spite of wearing masks, we catch it. That is because it also spreads by surface. So you can see sanitize is very important, social distancing. So these things, and if possible, if you can work from home, that is another important thing. There are people who can't work, like we have to go work every day, so we need to take precautions. But whoever can be at home and do his work, that's again implemented in many places. So let's go to the routes of transmission. So why I want to tell you is the first transmission that we discussed, that is surface transmission, it gives you a second chance. That's because, see, after a handshake, if the virus are transmitted from one person to another person or through any article, it could be an envelope or a pizza box or a milk packet. When you handle it, your hands get contaminated, but you have a chance to sanitize your hands. You have a chance to wash the milk packet with soap and water. So you can break the chain here. But in this case, where there is a direct transmission by aerosol, it's very important that you cover your mouth and nose with the mask and maintain social distancing, because this spread does not give you a second chance. Coming to 9 ways how you can protect yourself. So these are just simple points which we will cover in detail also. So first, as we've already discussed, wear a mask, wash your hands often, and after doing that, make sure you don't touch your eyes, nose, or mouth, because hands are contaminated. Okay, you should wear your mask. So in case if you don't have, and if you cough, please cough it in a tissue paper. Maintain social distancing. Throw the paper which is infected once you cough in it in a dustbin. Stay at home if you feel sick. Consult a physician for if any of the symptoms comes. Please get vaccinated. That is very important. Limit or avoid unnecessary travel. This is again very important. And in case you're already traveling and then you contract any symptoms, suppose you're in a flight of 4 hours and after 2 hours you realize that you're febrile, you have fever, please do not hesitate to inform the crew or to inform the medical staff so that they can ensure your safety and the safety of people who have got exposed. Now, how long the coronavirus survives on various surfaces? This is very important to know, because you buy stuff. So how long do you keep it? Which article you need to clean? All this you need to be very aware of. So let's go through it. So you see, paper, copper, only few hours. But if you go through this metals, the stainless steel, the plastic, it's almost 2 to 3 days. Glass, almost 4 days. And if you look at the paper money, it's 4 days. So this paper money, though you say it's paper, it's not paper. The currency money is made up of some cotton and linen. So the virus tends to survive for a very long time on it. Recent studies have shown that virus can survive on paper even longer, maybe 2 or 3 weeks. So it's very important whenever you handle money and you keep it in your wallet, please sanitize your hands. Second thing is, try to use online transfer, other modes of payment if you have, because then you can avoid touching the currency. Last but most important is the mask. The outside of the mask is contaminated and the virus can stay up to 7 days on the mask. So in case it's not surgical, but N95 many people reuse. So if you want to reuse, please reuse it at least after a week. Coming to how do you disinfect the surfaces? So this, we are all aware that we can disinfect the surfaces by any sanitizer which consists of 60 to 70% of alcohol. So you can sanitize your phone, your laptops, because you take it to your workplace, right? And if suppose you have a guest, keep a watch if they have touched the door handles, any light switches, please clean the switches, please sanitize the door handles so that it is sanitized. So next time when you touch, it doesn't come to you. Second thing, when you go out to a public place like for shopping, please wear your mask. Gloves is up to you, especially for medical people who are working in hospital, for nurses, or if you are taking care of someone who has COVID at home, that time maybe you can use gloves. Most important is, if anybody gets symptoms, and the best thing you can do is to stay at home. That's the best thing you can do to minimize the spread. Self-isolate anyone who has symptom in the household, and avoid going to populated places like outside, to restaurants, to malls, to theaters. And if you want to get fresh air or exercise, if you have a balcony on terrace, you can do there, or go to a place and in those hours where the grounds or the gardens are little free and less populated, and maintain social distancing. and wear a mask whenever you go outside, even for a walk. Now, why do we say mask yourself, mask yourself? So here is a simple diagram. You can see there are three people here. This one is the one who was infected, but she's asymptomatic. So they're just having a friendly chat. But this one is wearing a mask, this one is exposed. So maximum exposure is there. And you see if she's not wearing the mask, the number of aerosols that are liberated from her mouth is much more. But in the second case, when she puts a mask, the number of aerosols are much less. So that is why masking decreases the spread, it decreases the transmission. The second thing is distancing. Social distancing is also important because as the distance increases, the viral load is amount of virus that you are exposed to that comes down because they don't travel so far. So by masking and by social distancing, you can decrease your exposure because no mask is 100% protective. That is why, along with the mask, you need to have social distancing. Now, this person, she's not masked, so definitely she has a very high exposure and high chances to contract COVID-19. Coming to how to mask. So now as we know, the current wave, the second wave and coming wave will be very aggressive and it's spreading fast. So in this, there's a trend of double masking. So how do you double mask? So first to mention that N95, if you use, it is enough. No doubling is required for that. But if you're using a surgical mask, you can put it inside and over that you can put a cloth mask. So this is the best way to do double masking and get equivalent protection as you get from an N95. But don't use two surgical masks because when you put a surgical mask over another surgical mask, the fit is not good. So it doesn't give you that protection. So always, if you want to do a double mask, use two masks, a cloth mask and a surgical mask. Again, surgical mask should be inside and cloth should be outside. So this is the right way. How do you do doubling? Okay. A word about these masks with the ventilator. Please avoid them because this does not stop the spread. When you wear it, you protect yourself, but all the aerosols from your mouth travel outside to this respirator. So the person in front of you is not protected. He is exposed to the aerosols. So avoid these masks with the respirator on it. Coming to donning of N95 mask. Toning means how do you wear these masks? So few important things, especially for females, girls. You tie your hair behind, so make sure both the straps are above and the other one at the nape of the neck below the bun or below the clutch which you have put. In the front, there will be a metal which you will press to clip the mask properly according to shape of your nose. So that should be on the top, that should not go down. Second, the mask should be fitting very nicely and tight. Most important, in case if you want to remove the mask, please do not hang it on your neck. Because what happens is when you're putting the mask on your face, your neck and your clothes, these are all exposed. So if you face anyone who had COVID-19 and he's speaking and by any ways the aerosols are liberated, they will all deposit over your neck and on your clothes. And the next time when you push the mask down, the inner surface, which is the clean surface of the mask, that gets contaminated. And the second thing you do is you put this mask back on your nose. So that's how you transmit yourself. So the inside surface is clean. So whenever you want to remove mask, you need to follow a discipline. So we'll go through it later. Now let's discuss in brief, how do you wear a mask? So donning of mask. So most important is you clean your hands with soap or water or with a sanitizer before you touch your mask. Pull the mask from the box and then put it over your face and then you can tie it. So it's different for different types of masks. For example, if your mask is having ear loops, you can just hold the ear loops and put it across your ears. Suppose if your mask has bands, then you hold the mask over your nose and mouth and then slide the top band followed by the lower band. We'll see in practical how do we do that. Second thing, if it has ties, again the same thing. After cleaning your hands, you can first tie the upper knot and then the lower knot. After wearing the mask, don't forget to pinch the mask to shape it according to your nose. Okay. Coming to doffing of the mask, that is how do you remove it? Again, when you want to remove it, clean your hands first. If in case if your hands are contaminated, make sure your hands are sanitized. Avoid touching the front surface of the mask because that is contaminated. Only touch the loops, the ties, and the bands. Now, face mask with ear loops, you can just hold the ear loops and remove it. If it has bands, you can first remove the lower band and then the top one. If it had ties, similarly, first remove the bow which is below and then the top bow. Let's see in practice. We'll just stop the presentation. So, can you all see me?
Yes, madam.
Yes, ma'am.
Yes, yes.
Okay. So, let's see how do you wear the mask. So this is a mask which has the ties and the end. So what you do is you just place it over your face like this. Okay. Most important, first clean your hands with the sanitizer. Then you take your mask, put it over your face, cross the ties so that it fits properly and it's tight here, it's closed here. Don't forget to pinch it around your nose. Always remember that these masks, the colored surface is outside and this is the contaminated surface, and the inside surface, which is clean, that is the whiter one which is inside. So remember, you just pinch the nose. Now you're working for 2 hours. Now you want to remove this mask. So you don't touch. First you clean your hands with the sanitizer. Then you just pull the ear loops like this, fold the mask like this and hang it. Or you can keep it in a paper bag. Do not keep it on the table or anywhere, because if this surface is contaminated, it will all land on your mask. So this is how you put a mask with the ear loops. Coming to mask with the ties. So here, if you have a mask with the ties, again, after sanitizing your hands, you take the mask, put it over your nose, then you tie it, the first knot here, okay? Then you take the lower knot and you tie it below where you put your hairs. And it should be tight so that it's properly closed. Second thing is you pinch here. Sometimes even after pinching, there might be some leak, air leak from here. Especially for people who wear glasses, it can cause fogging of glasses. So what you need to do is put a small micropore tape, half here and half on your skin. So if you tape here, the air leak won't be there and you can avoid fogging. Similarly, now I want to remove. I've used it for 2-3 hours. Now I want to remove. So after I clean my hands with the sanitizer, I will again touch, but I will not touch the outside surface of the mask because this is contaminated. What I'm going to do is just open this loop here on the top knot, pull it like this, hold the ties, and again hang it somewhere safe if I want to reuse. If I'm done with it, I can throw it. Coming to N95, so these are N95 masks. Again, you need to identify which is the top part and which is the bottom part, okay? So there will be settings here by which you can make it tight. So how do you put an N95 mask? So this is a clean mask. So after cleaning with the sanitizer, now my hands are clean. This is a new mask. I hold it like this. For putting the mask, you always put the top band, okay? So you put the top band here. Then you hold the mask here because it can jump up. Then you put your lower stand. Fine. So you pinch your nose here. So you're well protected, and then you can make it tight so that there is no leak from any side. When you want to remove, again, clean it with your sanitizer. Your hands are now clean properly with the sanitizer. This time you remove the bottom. So you take it out. You don't touch the mask at all because this is all contaminated. Then you remove your top strap. Hold it with the strap like this, and then keep it aside. After you remove the mask, please don't forget to clean your hands. This I'm repeating again and again because this is very important. Many times you are not exposed to COVID-19 patient, but because your hands are dirty, you touch the mask and it get infected. Or you touch anywhere on your face and it can enter through your eyes, through your nose, or to your face. So after that, clean your hands and then you are done. So we'll go back to our presentation. Can you see the slides, all of you?
Yes, ma'am.
So how do you reuse N95 mask? So here you should not wash them, you should not bleach them, you should not dry them in very heavy sunlight. What you can do is just air dry it. What happens is the filter gets damaged because of this. So here you can put them in a paper bag and reuse it at least 4 to 5 times if it's not dirty. But if you feel that your N95 mask is dirty, then maybe you can change it earlier. Then how do you do this is you put it in a paper bag, and you can label these paper bags as Monday, Tuesday, or you can even put dates on it, and write one to, like if you've used it once or twice, and keep it in your home, and you can just close it. So these are not airtight bags, so air goes in and comes out and the mask dries properly, because if it stays moist, if it does not dry, fungus can grow on it, it can become smelly. So like that, every 7th day you can repeat the mask. So this is a Monday mask which I can repeat it again after 1 week. So this is for N95, but in case of surgical mask, you can just throw it. If it's a cloth mask, wash it with hot water and soap, and you can reuse it. So coming to the most important thing that's going on now, vaccination. So there are a lot of vaccine available in the market, and there's a lot of confusion which one we should take and which one is best. So just to cover the important ones, now we have Covishield, which is AstraZeneca. We have Sputnik, which is again using a viral vector. That means they have a vector, something like adenovirus, and the antigen is inside the virus, and that is what goes in your body. So the other one is Covaxin, that is Bharat Biotech vaccine. So now which one is good? Which is the best? What I will say is all of them are good. The best one is what is available to you, what you can take at your end. So please don't think I should wait for Sputnik or I should wait for this. Whichever is available now, which you can get as early as possible, please go at your end and receive the vaccines, because you cannot compare the sensitivity or the results of these vaccination, whatever has been given, because each study has a different design, has a different sample size, it's been done in different places. So you cannot extrapolate it similarly to each other. So we need to wait for the phase 3, phase 4 trials to get the complete results. But for now on, whichever vaccine you have, please take it. Now, why it's important, I want to show you this HRCT. So this is a HRCT, a CT chest of a person who has COVID-19 infection. So if you are not vaccinated, you see the lungs, how white it is. This is because it's completely damaged here. So these white areas are completely damaged. But you see here, this is the other person who has got vaccinated. So the lungs are not affected. It was just a mild or a moderate disease that the patient got. So vaccination does not ensure that you will not get COVID-19. You might still get it, but the symptoms will be mild and your lungs will not get so much affected. So this shows that you need to get vaccinated. Coming to the immune system. Now, what is immunity? Immunity is how your body can fight to various infections. So that is very important. You cannot develop immunity after getting COVID-19. It starts from today. So how do you do it? You do regular exercise and you take a good diet. Now, a few vitamins that I would like to stress upon is vitamin C and vitamin D. So these vitamins are very crucial to develop immunity. So C is readily available in all fruits. Fruit of the season is mango, oranges. You can get it very easily. Vitamin D, again, you can get resources. You can Google it, what all foods are rich in vitamin D, and you can take vitamin D in the form of food, as well as you can get yourself tested. Why I'm saying is, if you are deficient in vitamin D, it will not increase immediately. It takes weeks for the vitamin D levels to become normal. And especially in this lockdown where you're all staying inside, you don't have much sunlight to get exposed to. You don't go outside. So vitamin D deficiency is getting more common because you're inside locked up. So if you test your vitamin D, you will know whether you are insufficient or whether you are deficient, and you can consult a physician, take supplements now only so that your immune system get empowered. Most important, exercise. Please exercise at least for 20 to 30 minutes every day in the form of a small walk or any workout you can do at home. So this is very important. Now, in spite of vaccination, in spite of good immunity and taking precautions, sometimes when you come in contact with a person who has a heavy viral load, or it's unavoidable, what if you are taking care of someone who has COVID, you might contract COVID. So what happens if you're exposed to these aerosols? So these aerosols can enter while you breathe through your mouth or through your nose, and they deposit here. So if they're large particles, they deposit right here. The smaller ones, though, they go down to the lungs. Now, these viruses, over some time, they replicate and then they increase the disease severity. So, what will you do if you're infected by COVID-19? So the AIMS have issued a guideline in which they have described the spectrum of disease. Spectrum means it's not that disease, some patients can just have mild disease. Sometimes the disease can progress from mild to moderate to severe. So it's a chain. From one disease, the patient can go to the second stage and to the severe stage also. So let's see from the first, what happens on day one. So I want to really stress on this day one. Why it's important is you need to mark the day one of your symptom. I'll give you an example. So these are the symptoms: fever, sore throat, running nose, cough, diarrhea, GI upset, loss of smell. Even a perfume or deo, you won't be able to smell. Loss of taste. So when you eat food, you won't find it be all bitter. So this is very significant. It recovers very late. It takes 3 to 4 weeks time for this taste to come back actually. So these symptoms can come in any order, can come alone also. A person might just get sore throat, a person might just get fever, somebody can get first fever and then sore throat, or vice versa. It's not, there's no order for this. So if you get any of these symptoms in a pandemic, until otherwise proven, it is COVID-19. So if suppose you feel you got a sore throat and you think it might be just a seasonal cold, or if you get fever, what if it's typhoid? No. First thing you need to do is make sure that you know that mark your day. Thursday I got sore throat, Friday I got fever. So what's your day one? Your day one is Thursday, because Thursday you got sore throat. So after marking day one, isolate yourself and then you consult your physician. Then your physician will guide you how to rule out whether it's COVID-19 or something else, whether it is some urinary infection or typhoid. The physician will tell you. Now, you know now that you're COVID positive, then how do you take care of yourself? First thing, stay at home and don't panic, because you need to feel good. So have a good immune system also. So you should not panic. Be in the room, do something that you like, read a book, listen to music. Don't watch scary stuff on the news, the numbers which will panic you more. So do something good, be at home, and take care of yourself, like do gargle every 2 hours. So what you can do is you can do steam gargle, you can do a saline bottle gargle, and after 2 hours you can do a betadine gargle. Both are effective, the hot water, saline water, as well as betadine. 2 to 3 hourly gargles you do. Why do I say that? First, it gives you symptomatic relief. If your throat is paining, the pain will come down. Second thing is, this virus is heat sensitive, so it decreases the viral load also in your throat, the virus which is replicating. Second is steam inhalation. So your nasal cavity also has the virus. So when you do steam inhalation, it gives you symptomatic relief and also helps you to recover faster from COVID-19. Third, most important, stay hydrated. Drink a lot of water, take sips of water, try to drink some hot water too. Again, don't indulge in eating, don't eat too much, but eat healthy diet, take multiple time food, and take more of a protein rich food, because protein helps in healing. But if you eat a lot of carbohydrates and sugar, watermelons and sweet things, then COVID can become worse sometimes, because the virus feeds on the glucose. So take more of a protein rich diet, because it helps in healing. Second thing is prone positioning. Then do breathing exercise. Steam inhalation is also a good breathing exercise. Then you can take maybe a handkerchief and try to blow it, or there are many breathing exercises available. You can see on YouTube or Google and practice it when you're in isolation. Then monitoring the vitals is very important. So the simple vital that you should monitor is have a small probe at home with which you can monitor your saturation. So saturation, again, if suppose it's better than 96, 98, it's very good. And other vitals like blood pressure, if you have a BP apparatus at home, you can measure, otherwise it's okay. Most important is temperature. If you have fever spike, or you don't have also, if you're just feeling malaise, every 3-4 hours, check your temperature. So this keeps you alarmed how your disease is progressing. Now you need to protect your family members and your caretakers. So first thing you can do to protect them is don't mingle, just isolate yourself. Please be in a well ventilated room. Prefer open windows than air conditioner, because you need to breathe fresh air. Second thing, wash your hands little more longer time, like 40 seconds, or use a sanitizer. Wear mask at all the time, the triple layer mask. But when you're coming in contact with a caregiver, prefer a N95 because it gives you a better protection. Discard your mask after 8 hours or early if it gets dirty or moist or soaked. So better to discard it, and you can disinfect with 1% sodium hypochlorite. Suppose you don't have it or it's not available, at least throw it in a closed bin. Don't share your personal items with other people in the household. Ensure that all the surfaces in the room which you have touched, like the tabletops and all, are regularly every day you're cleaning it, especially once you recover. Now, coming to symptomatic management, normally this is done after consulting a physician. You can do, like we have teleophthalmology. So online you can consult a doctor, or you can consult them on the phone and do symptomatic treatment. Like for fever, you can take antipyretic, simple paracetamol. For cold, you can take any anti-allergic tablet. The physician will guide you for that. A course of antibiotic is normally given. Again, your doctor will be the best person to tell you what antibiotic according to your systemic conditions, and take vitamin supplements again, that is vitamin D, vitamin C, and zinc supplements. Coming to proning, so I was talking about proning. Why it's important is your lung, major part of your lung is in the front as well as on the back side. So all the lobes of the lung need to expand while breathing. So half an hour you can spend in different position, like prone, upside down like this, or sideways. You can use pillow to support yourself. So this you can practice whenever you want to take rest. Don't do it for an hour after meals. So proning has few advantages. First, it helps your lung to expand properly. And when you lie prone, the congested alveoli, they're like balloons filled with air. And when they get congested, the fluid fills in them. So when you lie prone, they get drained. So that is again helpful. So try proning for self-care at home. Coming to day 3. So day 1, day 2, day 3. So don't do your RT-PCR in hurry and panic. Please wait till 3rd or 4th day. Then do your RT-PCR, because if you do early, it might come negative. Do on the 3rd day. If it comes positive, you already know that you have COVID-19. If it is negative, but you have symptom like GI upset, you have lost taste, smell taste, all the sensations, or you just have fever, but you're not sure, but still isolate yourself, because many times RT-PCR can come negative. In some of the variants where the GI tracts get affected, nasal cavity is clear, again, it can come negative. So still continue your isolation. Now, I want to talk about these 2 days, that is the 6th and the 7th day. That's why I told you in the beginning, mark your first day. That's very important. So when you come to your 6th and 7th day, you need to keep an watch. Have your symptom resolved. So suppose a person had fever, cold, cough, and on the 6th day, he feels perfectly fine. His sore throat is better. He has no fever now. Then he can just continue the isolation. But in case if he feels that the symptoms are persisting, his sore throat is still there, in fact, it is worsened, he never had fever, or he had fever, but now he has got another fever spike, this is the time that you need to do your blood test and your CT scans. What blood tests I have mentioned here, these are the few important blood tests which are the markers for various complications which can come, but you need to do it only after consulting the physician. And please do a CT test here. Why? Because you have a saturation, you are seeing your saturation is 98, so you don't want to do a CT scan. But then when your blood tests come, you had a fever spike, your blood tests are very elevated. So what happens is, only when the lungs get involved, there is significant damages in the lung, that's when your saturation starts falling, and you don't want to wait till the saturation falls and till further damage to your lung happens. So in this case, what I would suggest is, on day 6 and 7, what is kept in mind, if your symptom persists or worsen, consult a physician, do the blood test, and get the CT scan done. Okay. And whenever you check your saturation, if it's coming 98%, that okay, then you do a 6-minute brisk walk test. Walk for 6 minutes briskly in your room, and then again check saturation. If it is normal, very good. But if it is dropped, that is something alarming. Okay. So now we know the signs of worsening. So if any of the symptoms have worsened or fever has come, please communicate to your physician. Continue the medications for your comorbid illnesses, like if you're a heart patient or diabetic or hypertensive, continue those medications. And please talk to the consultant if he advises you any admission in the ward or ICU based on your symptoms. So these are usually very symptoms for very sick people, like if they are not able to breathe, if there's a dip in saturation less than 94%, if a 6-minute brisk walk following which the saturation is dropping, he's having some kind of chest pain or some confusion. So all these things are signs of worsening and you need to consult your physician. Again, going to the AIMS guideline, we know in moderate disease, the admission is usually done in the ward and patient is kept under observation. With the severe disease, patient goes to ICU, where according to the symptoms and the comorbid illness that the patient has, the consulting physician decides his treatment. So normally they give steroids or anticoagulation. Now, what is anticoagulation? Normally, you know that it causes something called disseminated intravascular coagulation. That is, the clots are formed within the blood vessel. So many people after recovering, they get a cardiac arrest. So these patients can have elevated D dimer, CRP, ESR. So they are started on anticoagulants, so that the blood thinners, they are called in lay people. So the blood is thin and doesn't clot. So all this your physician will decide. Coming to remdesivir, the antivirals, there are many other drugs, tocilizumab. This is all based upon the patient's condition. Okay, it is not that please don't take them at home. Consult physician, then only take it. Now, this is just to summarize the COVID days. Your day 1, very important. Day 3, you do your RT-PCR. Day 6, be alert, watch your symptoms. If worsens or increases or persists, do your lab test, consult a physician and get your CT chest done. Now, when do you end your home isolation? So at least when 10 days have passed from the onset of symptoms and for last 3 days you didn't have fever, so then you can end your home isolation. Okay, so minimum 10 days of isolation is what the Government of India Ministry of Health advises, but normally we just do 10 days to 2 weeks of isolation. That is what is preferred, because even after COVID, sometimes you will feel that you're very tired and it takes some time for you to recover. So 10 days to 2 weeks is important. And there is no need for testing once you're asymptomatic and you've recovered, because in some patient RT-PCR can be positive for a long time. It can be even because of the dead virus. So it doesn't suggest that you still have the disease. So it's not mandatory to do COVID testing at the end of isolation. A last word about mucormycosis. Now, everybody is, black fungus is spreading, but it won't spread like that because it's a very weak fungus. What I want to tell you, this is a common mold. Okay, the common mold which grows over the bread, which is in your kitchen, that is what is mucormycosis. Okay, so this is an opportunistic infection. So, what is opportunistic infection? It means that it does not infect the normal person. It infects when your immunity goes down, when you're immunocompromised. So, in diabetics, the sugar levels, if it goes up, or a COVID patient who's receiving steroid, because of steroids, sometimes the sugar goes up. That can cause decrease in immunity. COVID itself decreases immunity because patient is sick. Steroids, when they are given, they bring down the person's immunity. So all these things bring down what is the immunity. And when immunity goes down, these fungus which are very weak, they get this opportunity now to affect, so they are called as opportunistic infections. So this happen, and then antifungal treatment is normally given for 2 to 3 weeks. So the treatment is okay. The thing is the damage the fungus causes. So for that you have to be very alert to identify the symptoms of this mucormycosis. So as called black fungus, these are not black, the fungus is not black, but when it causes the tissue damage, the whole tissue dies. So it becomes necrotic. So that appears black, and hence the name black fungus. So suppose if it starts growing in the nose, it will destroy the tissue inside the nose. If it is in the eye, it can destroy the whole eye, and surgery, you might have to remove the whole eye. So it's very painful and traumatizing for the doctors as well as for the patient. So the best thing is to prevent it and to identify it early. Two important things. So what are the symptoms? So a person suffering with COVID on treatment, if he develops any nose block or foul nasal discharge, redness in the eyes, swelling of the eye coming in front, headache, any skin rashes around the eyes, All these are alarming symptoms. It can be mucor. Please consult the doctor. If it's nose, consult the ENT. If it's eye involvement, consult the ophthalmologist. So how you can prevent it, the do's and don'ts: control the hyperglycemia. Many diabetics, when they contract COVID and they're started on steroid, they're spike of sugar levels. So that has to be controlled. Monitor the blood glucose level, use the steroid judicially, and especially you see a lot of oxygen is being given. So change the oxygen tubing regularly. There's an oxygen humidifier. There's a small glass tube, plastic tube, which is filled with water, which humidifies the oxygen that you breathe. So those humidifiers should be filled with clean, sterile water, distilled water. But if it is filled with tap water or dirty or old water, then again mucor can come. Now, coming to use of antifungal, again, it's used according to the consultant choice. Coming to don'ts, don't miss the warning signs of the fungus. That is, don't miss if you have a nose block, don't think it's just sinusitis you always had. You just had COVID and you have a nose block. It can be mucormycosis. So please get an ENT opinion as soon as possible, because don't lose crucial time to initiate treatment. The more time you lose, more damage will happen. So don't even hesitate to seek aggressive investigations. So normally, if there's any nose involvement, they might do an endoscopy or imaging of the eye. These are very important, because sometimes only when the disease progresses, then only the symptoms come, the eye starts coming out. But at that time, the disease already progressed. So if you want to catch the disease before, the investigations are very important. So please seek medical care immediately. So if you can detect it fast, you can treat it better. So how do you prevent it? Please dry your mask properly, because moist mask, dirty mask, fungus can grow within it, and then you keep putting it. So dry your mask, and double masking, throw the inner mask away, wash the cloth mask properly, dry it in sun. Check the inside of the mask before you wear. If it's dirty, if any fungus is growing, if it's smelly, then it's not that you have to use it N95. You should use 4 to 5 times, nothing like that. If you've used just once and the next time you use, you feel the inner surface is dirty, please discard it. So this was about mucormycosis. A word about ongoing and post-COVID. Many people, especially the elderly ones, after PCR negative also, they have ongoing COVID symptoms, like they can have a lot of fatigue, muscle weakness, joint pains, headache, anemia, a lot of other complications affecting different body organs. So these people need special attention, and you need to consult your physician regularly, because it's not just 1 week, 2 week that COVID ends. Sometimes even post COVID, the complications can persist. So to end, I would like to say that no one gets away with anything ever. So take responsibility for your own life. So the best you can do is take care of yourself. So when you take care of yourself, others around you will watch you, they'll follow you, and you need to be responsible. So in order to be responsible, you need some discipline in your life. So in your college, you all come at same time, you leave at same time. All of you wear same uniform. There is discipline. This is what you need to follow. It's not that you're wearing mask and your best friend comes and you want to have a coffee, you get under, you remove your mask and then you have coffee. That's when your guard goes off. That's when you can, if the person is asymptomatic, he can or she can give you infection. So please wear mask all the time. Do not remove your mask even with the closest friend of yours. Please maintain social distance, especially when you go for your breaks. Make sure there is enough distancing, and you go at different times. Spend less time during the breaks to have your lunch or your coffee. Sit separately and have. So these things are very important. So being responsible, following discipline is very important in breaking the chain of COVID-19. So be the change you want to see in the world, as told by Mahatma Gandhi ji. So I believe that all of you are already following, but sometimes it hurts when, in spite of following, we still get COVID-19. That can happen, but nothing to panic. You need to know the disease so that you can fight. So if you think your enemy is weak, you cannot defeat it. Think your enemy is strong, know everything about it, and take all precautions. And just by wearing mask, you cannot get away with COVID. You need to wear and remove it properly. Whenever you handle your mask, make sure your hands are clean, dispose it properly. Don't touch unnecessary your face, eyes. So this is very important. And again, at your home, whenever you receive any parcel or articles, based on how long the virus survived, please clean those articles and then only use. Okay. So thank you a lot for your patient hearing. Hope you have all benefited from this. I would really like to have questions if anybody wants to ask.
Yeah, dear audience, COVID 19 has been changed a lot of aspects of our professional and personal life. And here I am totally agree with Dr. Aliza that we should be careful, responsible, and take precautions as while going out or in contact with others. So thank you, Dr. Aliza, for such a nice and informative suggestions and sharing with us. We'll surely take care of masks and all as you guided us today. Now this is the time for viewers' questions. So therefore I would like to invite Professor Rachel Pawar for question answer session. Rachel ma'am, over to you.
Thank you, Bhavna ma'am. Good evening, everyone. Good evening, Aliza ma'am. We'll be taking questions from from the faculty members and from the people over at YouTube, for which I request the faculty members to please raise hands, and we'll be calling them one by one so that they can ask their questions themselves. And we have a few questions over at YouTube that I'll be asking to ma'am directly. So faculty members, if you have any questions, please put your hands up. You can raise hands and I can invite you. We'll begin with Goldie ma'am. I see that's a raised hand there. Goldie ma'am, your question, please.
Yes. So, Eliza ma'am, I would like to know, like I have been vaccinated and it has been a week, and I've stopped exercising due to the fact that little weakness is there. So, for how many days should I not do the exercise? One thing. Another thing is, after vaccination, I have a lot of perspiration. Otherwise, also I had, but this perspiration is added with anxiety. So something, if you could tell about it, I will be very, very grateful to you.
Yeah, so as first of all, it's a good thing that you got vaccinated. So that's the first thing. And coming to your difficulty, like the perspiration you're telling, that most important thing in vaccine is you need to know if you're allergic to it. So in case if you have not developed any immediately after the injection, that is at first half an hour, 1 hour, if you have not developed any allergic reaction or any skin rashes or you couldn't breathe or something like that, those are the allergic symptoms, that you are not able to breathe or you have skin rashes or you felt giddy after the injection. So these things, if they are not there, then nothing to worry. Sometimes what happens that these vaccines are giving different types of some patients might get just fever, as you just got this perspiration, maybe it's just the weakness. So coming to exercise, definitely for 2 weeks you should avoid. That's what they say. After vaccine, for the coming next 2 weeks, you might feel tired. So avoid doing exercise. You can do your daily work at home, but don't go for workout and exercise for 2 weeks, because your body will be a little weak, because you are exposed to an antigen and antibodies are forming. There is a process happening in your body. Perspiration, I would appreciate if it is the sweating is too much, you need to consult a physician in case you're having any other comorbid illness. Like it's different if a person is a heart patient and if having perspiration, it's something important, so you need to consult a doctor. So in case if you don't have any other systemic problem, then it's okay. If it gets too bad, if you're sweating too much, then you just consult the physician once, check if you have a BP or sugars, check your blood pressure at home, how is it. If you can do your daily work, then I don't think you need to worry about it. But and it's summers, it sweating is common in summers. So if it's really, you feel it's really bad, it's more than what used to happen, then maybe you can have a opinion with a physician, especially if you have other systemic condition like hypertension or any other problem.
Thank you, ma'am.
Thank you, Goldie ma'am. Thank you, Lisa ma'am. We have another question from Dr. Ravi Vyas. Sir, your question, please.
Thank you, Rachel ma'am. And good evening, Dr. Lisa.
Good evening.
Now, yes, ma'am. Actually, from Monday onwards, we'll be busy. Our college will be the center for open book exam collection.
Okay.
And a lot of students will be coming. Like students will come in like hundreds and hundreds of number.
Okay.
And they will submit their handwritten answer books to us. And we have to take their answer book by our hand, and we have to enter their details in a register.
Okay.
Then they'll sign there also. Now after that we have to enter the same details in a system also,
Yes.
and all these things are there. So I am little bit concerned about, because you have told that if somebody has given you some article also, like paper also, it may contain some type of virus in it. So
Yes.
how we can avoid this type of thing, like because
Yes.
it is a thing we have to do, but how we can save ourselves?
Yes, so this I would like this what I was talking about is there are two conditions. Okay, there's first situation is when you are at your home and everything inside your home is clean and you get a milk packet from outside, and or you get a pizza box from outside, so that is something which is can be contaminated, so that you need to clean and then only bring it and then clean your hands. Okay, but we also go to hospital, our patient bring lots of reports, we need to see the reports, so in front of patient we have to take them in our hands and go through the reports, and I can't keep putting sanitizer again and again. But yeah, what I can do is I will not touch my face. That is the most important thing you need to remember. In the hospital, when we are seeing patients, we wear a mask, we maintain social distance when we talk to them, when we receive things for them, we go through it, we return them back. Then we immediately clean our hands. But as you told, when so many students are coming, you can't keep sanitizing hands again and again. So in that time, suppose you're seeing 5 students, you can see them, your hands are contaminated, but don't carry that infection on your face. Don't touch your face, don't touch your eyes. Now, suppose you feel thirsty, you want to drink water. At that time, please sanitize your hands, then take your bottle and drink it, and then you can go back to your work. So, the fomites which are there on your hands will not jump and go to your nose because you are masked. It will go only if with those hands you rub your eyes or you touch your mask, then it is sitting right on your mask. So, when you are at your workplace, you can sanitize hands more often and avoid touching your face and nose. That's what you can do. That's what we also do. And when
Thank you
you're
so much.
talking to your students, please maintain
Hmm.
distance.
Sure, ma'am. Sure. Thank you so
And
much.
make sure their mask is properly. Many times they won't wear the mask properly. It should be above the nose and below the chin. So if
Yes,
their mask,
actually, actually, ma'am, we have a very good practice at our college also. Like those who have don't wear the mask, we don't allow them to come in inside our campus also.
yeah,
And at the COVID protocol was also undertaken last year also. Seriously, it will be taken this year also. Thank you so much, ma'am.
yeah, thank you.
Thank you, Ravi sir. Thank you, Lisa ma'am. Rest of the faculty members, if you have any questions, you can raise hands and I'll invite you to ask your questions. In the meanwhile, we'll take some other questions that the audience has. So I'll be reading out the questions to you, ma'am, and you can answer in your time. So with
Yes.
the third wave and new variants of COVID coming, are we going to see any changes in the symptoms that we already know?
Yes. So coming to the symptoms, whether the new variants are coming, as I told you, with the existing variants only, the symptoms are very different. We have seen patients who have presented with arthritis, joint pain, and just body pain with COVID. Some people come just with headache. Some have come with skin rashes and fever. So the symptoms are very variable. And with the new strains, might be new symptoms come. So what's going to come, we are not aware. But existing symptoms, you need to know. Second thing, symptoms in children might be totally different, very different from adults. So as I've already covered in the first slide, they will not have so much of maybe cough. They might just have difficulty in breathing. So you need to check their respiration, their activity, whether they are active or not, whether they're eating well or not. Can they smell if they're old enough to tell you, whether they are febrile, and the disease in them is more severe because it have multi-organ involvement. In adults, normally it's the upper respiratory tract and the lungs that normally gets involved, and it is this clotting which is happening causing cardiac arrest and other things. But in children, liver, kidneys, multiple organ can get involved and inflamed. They can have skin rashes also. So the disease could be very severe in them. So that is why it is very important to protect them. They can't do it themselves. So adults around them have to be very careful.
Thank you so much, ma'am. That was really helpful. We'll be taking another question and then I'll be inviting Swati, ma'am. So another question says, how to deal with asymptomatic cases if we don't know if we don't know about if you're COVID positive or not, how are we going to protect our loved ones?
Yeah. So second thing is, this you're talking is like when you're at home it's very difficult. I don't advise you to start wearing mask at home thinking that everybody, because you are all exposed. So only if somebody develops a symptom at home, that's when only you can isolate the patient. You will definitely not know before your loved ones at home have symptom. It's only when the symptom comes, that time you need to isolate. Okay, and then you need to take precautions, like if there are 5 members and one person has got fever, that person is isolated, but there's a high chance that the other 4 people are also exposed to COVID. So in that case, if they have an exposure, definitely it's a high exposure because you don't wear mask at home. So if you're working, you need to inform at your workplace that you are exposed to your family member who has got COVID, and you also need to stay at home. And the person who is isolated should consult physician and take treatment. But at home, the other people can do what is like, they can also take healthy food, they can do inhalations, or they can do regular gargles, and keep a check if they are getting any of the symptoms. But do not go get yourself tested immediately. Suppose you get to know on Wednesday that one of the person in your family has got infected, then wait for 3 days, because you, on the third day only, you're going to test the person who's got infected. So you, if you want, after 3 or 4 days, if you don't have symptom, even then you can get yourself tested, because what if you are asymptomatic, and then you also need to get isolated. So on the third day of exposure, even the other family members, that's what we are doing here. If one of us doctors get infected, the other family members also start taking all the precaution. They don't go outside, they all stay at home, so they prevent the spread outside. And on the third or fourth day, they get tested. If they are negative, then they can freely be at home taking care of the person who is isolated. And if they find that they are infected and they are asymptomatic, they again need to get isolated inside the house. And the negative, the people, the family members who are negative, they can take care of the cooking or whatever other work is there at home. So that you have to be careful.
Thank you, ma'am. I see Dr. Swati Singh has raised hand. Swati, ma'am, your question, please.
Yes. Thank you, Rachel. Thank you so much. Good evening, everyone. Good evening, Eliza, ma'am.
Good evening.
I have two questions. First is double mask. Ma'am, it's very much suffocating double mask, because sweating is my problem. So,
Yes.
do we have any other alternative for mask, double mask?
Yes, we have.
Yes,
The
ma'am.
best alternative is wear a N95. The thing is, N95 gives you more protection. So use a N95 mask if you have problems of like, you can't take up double mask. Use a N95, and maybe you can take breaks. Sometimes even when you want to breathe, you can go just in a place where there are nobody around. You can remove your mask for some time, sip some water if you feel uncomfortable, or go to the washroom, and that time you can remove your mask for a few seconds and breathe freely. So that you can do it, but prefer N95 or double masking.
Yeah. N95 is one is enough, no? Yeah, ma'am.
Yeah, N95 one should suffice, but
One
again,
mask N95 is enough.
enough. We doctors, we do double masking even with N95, because we see a lot of patients who are COVID positive. But for lay people, N95 alone is enough. You need not do double masking with N95. But again, it is only 95% protective. 5% risk is there. So you can power it on with your social distancing. Maintain
Sure,
this.
ma'am.
That will help.
Sure. Yeah. Thank you so much. My another question is prone position. How, like, should it be the part of sleeping pattern, prone position on daily basis? We should sleep this way, ma'am?
No, not daily. These are the people who got COVID. Suppose a person is COVID positive. So if you're COVID positive, what happens is, as I told you, best is breathing exercise. Lungs are like balloons, okay? They should be filled only with air. But if they get filled with fluid, they cannot move, they can't expand, and you will feel dyspneic, you can't breathe after some time, and the infection will increase. So you need to give them space to expand. So there is not one lobe, there are 2-3 lobes of lung, front and back. So you normally sleep front for some time, maybe for half an hour. You can turn prone and sleep, so that the other lobes also get space to expand. That's how it is. And it has to drain the fluid. But you can use pillows to comfort. But it is not for normal people. It's only once you get infected. Yeah.
Right. Thank you so much, ma'am. It was with big confusion to me. Thank you so much.
Thank you.
Thank you, Swati ma'am. Thank you, Lisa ma'am. Dr. Suvarna Lapalekar in the chat box has asked that how long should we wait after once we have been COVID positive? How long should we wait? How long should we wait to get vaccination?
Yes, now this is a very important question. So you know that once you get infected by COVID, the disease course only is like around 1 to 2 weeks. So you should not take vaccine at that time. You should wait at least for 3 weeks, consult a physician after 3 weeks, and then only take. Because as I told you, there is something called on-COVID and post-COVID. That is, sometimes even when the acute phase of COVID goes, some of the people can have a post-COVID. That is, they might have some organ failure symptoms or dyspnea or breathlessness. They might become okay, but they will have breathlessness. They can't walk steps or they can't climb stairs. So in such cases, consult a physician, especially if they have a comorbid illness like diabetes, hypertension, heart problem, any clotting problem, any other disease. So 2 to 3 weeks, definitely. That also, please have a word with physician before you take, based on your symptoms.
Thank you
Second
so
thing is, I want to
Sorry.
add here, there are few cases like we got few cases where the person has received the vaccine and they had fever next day. So fever is very common. So normally after the vaccine, the fever comes for 1 or 2 days. Some of the people got fever for 3 days also, but it's a low grade fever. Rarely it can be 103, 104 also, but it goes off in 2, 3 days. Okay. There are few patients who got fever for 1 week now, that, and they thought it is because of the vaccine, but that was not vaccine fever, that was COVID. And when they tested at the end of 1 week, almost 30% of the lung was infected. So what I want to tell you is, even after vaccine, there's a high possibility you took vaccine on Monday, but you would have got exposed the previous week to a COVID patient, and it was a coincidence that you developed COVID and you took the vaccine very close to it. So if the fever after vaccine is lasting for longer time, it's high spikes of fever. If it's only 99 and all, it's fine. But if it's 100 and 304 lasting for 2, 3 days, please be careful, consult a physician again. If you want on the third day, fourth day also fever is there, you can do RT-PCR even after getting vaccine. What if you've got COVID after that? That is very important. And when you take vaccine, after that, please hydrate yourself. Drink lot of water for those 2, 3 days. That helps you cools down your body and you don't get high spikes of fever.
Thank you, ma'am.
Thank
That
you.
was really helpful. And I believe this will be the last question that we take in this session, unless any other faculty member has any question.
Yes.
So the last question for the day, these are two questions actually. So can you please help us know some reliable sources from where we can get more information, with a lot of misinformation spreading on the web and on the social media networks, some reliable source to get the information? And are the physical tests like blood tests or some other physical tests enough to detect that if we are COVID positive?
Okay. Coming to reliable sources, if you're there are two types of sources. One is someone who had COVID. So if they share their experience, that is really valuable because they have gone through the disease. So you can always talk to them. That is one source that could be trustworthy because you can get to know what treatment they have taken, especially if they become okay. So take their advice. That's a common thing you can do. Second is source from the online. Now everybody wants to go online and see on Google. Again, there can be multiple things, but as I've mentioned, I've taken guidelines from AIMS. I've taken guidelines from government of health ministry. So these are the reliable thing. If you go on AIMS site, they will give you so much information about what to do, when to isolate, when to get discharged, what all treatment, so that even what is happening nowadays is when you go to hospital also, there is very less transparency. Even the doctors, when we admit our loved ones, we are not aware of what treatment is given to them. It's not being told to us. So it's a prime responsibility of all of us to know what is the basic treatment. That's why I put those AIMS guidelines, so you can always Google it. So you know, when if you get a severe disease, when you go to hospital, they normally treat you with steroids. Then they need to monitor your sugar. The water should be distilled water in your humidifiers. If you're on oxygen, they might give you some antibiotics. You need to be very vigilant if you develop any mucormycosis symptom. They might start you on blood thinners, which are called heparin or anticoagulants. So if you know a little bit about it, it's like general knowledge, you know. Everybody is not engineer, but they know to repair few stuffs at home. So you need to have some general basic knowledge how I might get treated if I go to hospital, so that when you go there, you can question, you can see if your treatment is going correct place, whether you need to change, you need to speak to the doctor, take someone's opinion. So that is very important. So when you go on online, please consult AIM site or the health ministry site. Those are very important. Okay, official site. So, third is the physicians. Any doctor who has experience in treating COVID patients, and who, if your loved one is treated by a particular doctor, got well, you can get his number or you can get his email ID or can talk to him. So that will be the best thing. The medical professionals, they will have experience and they can guide you best, because each case is different. So that way should be the thing. Coming to physical test, as I already told you, RT-PCR is must on the third day. Even if it's negative, it does not mean that it is not COVID. Many variants, like when it affects GI, it can come negative. Third is 6th to 7th day, when the disease goes from the upper tract to your lungs. That's when you need to, if your symptoms are worsening, you need to do blood test. Now, each blood test has a different significance. Suppose if you do a D dimer, if it's come high, that means clotting can happen and you can have a heart attack or cardiac arrest. So these patients are given blood thinners. Suppose ESR CRP is very high, which is normally high, steroids are started. So there are different things, and CT scans have to be done if ESR CRP D dimer is high. So CT scan will tell you whether lungs are involved. So this is very important, because if lungs is only 10% to 20% involved and you start treatment, you will have a better recovery. But if you wait for your saturation to drop and then you do CT scan, it's already very late. So always remember, on 6th to 7th day, if your symptoms are worsening, you might do few blood tests and CT scan that is there. And you can consult a good physician. That is very important, what test to do. Because if I tell you all the tests, these are expensive tests and you'll end up doing all of them. So based on your condition, your age, your comorbid conditions, the tests are planned. Okay, so consult a doctor to find. But mark your day one and assess yourself every day. Are you becoming better?
Certainly.
And it is not just 6 or 7 day. If someone is like a very old 70-year-old lady who has heart problem, they might progress little faster also. So be very careful with vulnerable people, that is old people, and especially in the third wave when kids can get affected. They won't tell. You have to keep an eye on them. Okay, and especially the mothers or the fathers who will be taking care of the child, make sure you are well protected with the N95 mask, and you take your similar protection, like do stimulation gargle every day, even though you are not COVID positive. So please, if your child is doing, when you go to your room, you also do, and you need to isolate. Suppose there are 5 members and the child has got COVID and mother is taking care of the child, both mother and child need to be isolated, and the other family members can get themselves tested and they can help them.
Sure, ma'am. Thank you so much, ma'am. That was certainly very helpful. We have many other questions in the chat box here. I'm certain that everybody wants their answers, but considering the time constraint, we are going to pause here. And thank you so much, ma'am, for answering very patiently to all our questions. It was indeed very helpful.
Thank you.
Over to you, Bhavna, ma'am.
So thank you, Eliza. Thank you. Thank you, Eliza. It's a nice, informative, excellent class.
Thank
so
you.
We clarify our doubts also. So thank you for you receive my invitation also without any hesitation or excuse. You take it so happy. Okay, thank you. God bless you.
Thank you, sister. I want to really thank you for giving me this opportunity and to talk to all of you, because it is a privilege for me if I can share little of my experience and knowledge with all of you, because it's very important. Now we'll kind of have more responsible people and we can more better to stop the chain of this infection spread. So that's great. Thank you, sister, so much. Thank you so much.
Thank you. God bless you.
Thank you.
Yeah, thank you, Dr. Eliza, for answering very articulately. And thanks for you, Professor Rachel, for handling query session very nicely. So now, dear participants, we will be sending a feedback form link of the guest talk through WhatsApp group. Please fill it. Now, again, I would like to invite Professor Rachel Pawar to propose vote of thanks.
Thank you, Bhavna, ma'am. Acknowledging the good in your life is the foundation of all abundance. deem it my honor and privilege to present this formal vote of thanks. First and foremost, with a humble heart, I thank God Almighty for His grace and providence for all of us gathered here. I express my heartfelt thanks to our today's guest speaker, Dr. Eliza Anthony, for sparing time to join with us today and for a wonderful and insightful session. Also, for her contribution towards the society as a health worker during these tough times. I extend my warm gratitude towards our patrons, Director Reverend Father Simon Raj, Principal Dr. Sister Alice Thomas, for being a constant beacon and steering all our efforts towards concrete development and growth. I sincerely thank the IQSC team members for their untiring efforts in putting together this program. And last but not the least, I thank all the faculty members and the audience over YouTube for joining with us today. Your presence makes this event a success. I conclude wishing you all a wonderful evening ahead. My best regards.
Thank you, Rachel ma'am, for your vote of thanks. So once again, a big thanks to all the dignitaries who joined us for the event and make this event a successful one. Thank you, Dr. Eliza, once again. Thank you, sister. Thanks a lot. Thank you, everyone, to join us. Over to you, Goldie ma'am.
Thank you, sister. Thank you, Eliza ma'am. And thank you all. Thank you so much. Indeed, a very nice session. Very, very nicely handled. Thank you, thank you. Thank you, everyone. Thank you, Stefford sir. Thank you, Bhavna ma'am. Thank you, Rachel ma'am.